Hi, Trixie. Okay. Hi, Trixie.
Hi. Hello.
Okay. So now you can hear me. Can you see me?
Yes, I can.
Okay, good. All right.
Are we on live now?
We are. We're waiting for our questions. I'm
So let
excited to see how it goes.
me too. I'm really excited. So let's just wait. Let's just wait for our
Yeah.
people to be. Let's see.
Let's give another 2 minutes here and then we can start. I'm hoping people those who uh, were interested in attending the event are here. And if everyone is here or people are joining in, we'll welcome them. All right. Okay. I guess we should start. Trixie.
I think we can play first for our presentations video
Mm-hmm.
to be start off.
I guess we should start our live session now. I'm hoping many people have joined us. Looks like we lost Trixie here. All right. So I think we'll wait for Trixie for another couple of minutes. She's my moderator. Hoping to get her on the stream soon. All right. Let me start the introduction. Maybe Trixie's having some issues with her stream, some technical issues with the stream. Um, I just want to start with introducing myself. My name is Ritu Bhatnagar, and I'm the managing partner and founder of Neolytix. I've been working with medical billing, medical healthcare industry for more than 2 decades now. And I have worked with a few companies in uh, in California, in Illinois. I'm based out of Illinois, and I founded Neolytix more than 10 years back. So half of my work is in Neolytix, and I am really thankful to be a part of this wonderful company. Thank you so much for your interest in this stream, in this session, and I'm hoping that I'll be able to take up your questions and able to answer some interesting questions coming my way, and try my best to help you in getting the ever growing list of questions in the healthcare, insurance, medical billing world, because medical billing guidelines and coding guidelines keep changing, as we all know. So I'll once again see if I can find a moderator who can help me um, with the questions. Oh, we already have a lot of questions coming in. So I'm going to start taking the questions until my moderator, Trixie, can, join us. And let me see the first question. So the first question we are getting is from an SLP, speech therapist, who's asking, can interns bill Medicaid for students they are treating with supervision from certified SLP? So SLP is speech pathologists who are taking care of speech therapy. And the answer to this question is yes. SLP interns can bill Medicaid. For that matter, they can bill other insurances as well, provided they have a supervisor, a certified supervisor, SLP, and the supervisor is aware of the treatment plan the students are, taking care of. And those people, all those claims actually will go under the supervisor name, not under the student's name. But the insurance knows that the student is the actual rendering provider, as we call them. But supervisor is the supervising the treatment and that particular visit. So the supervisor has to co-sign the the progress note for that particular visit or any further visits. So hope that question is answered, because I don't know who asked that question, but yes, the answer is yes, you can bill if you have a supervisor, certified supervisor. Okay, what's the next question? All right, so we have a question from Kelly Caldwell. Thank you for the question, Kelly. In the mental health field, are you aware of life coach codes? Wow, that's a very interesting question. I've heard of life coach in the general mental health field, but these particular codes we have not billed to any insurance successfully till now. But I have definitely heard of very different kind of coding, which is coming up, especially post-COVID, where the mental health is expanding every day, every minute. And it is, but many codes are paid, many codes are not always paid or recognized by insurances. If you ask me about these particular codes, I have to look it up. I'll probably ask my senior medical biller, Vasanta Kumar, to help us get the definition of these codes, 0592T and 0591T, if these are, first of all, recognized by Medicare, because Medicare is our main I would say, is the Bible of what codes will be recognized by most insurances. So we can definitely give you more insight into whether they will get paid based on if they're recognized by insurance, most of the insurances. And it will also depend in which state you are in, Kelly, because every state, every Medicare contractor will have their own rules and regulations. And so would Anthem or Med or Blue Cross or United or Aetna for that matter. So the state matters for any codes to confirm that they will get paid or not. So, Vasanta, thank you so much for your help at the back end. I know you are working diligently to help us get these answers as fast as possible. So, 0592 is health well-being coaching, and Medicare accepts that code, and it is really new. It's like just started in October of 2022. Now that comes the second part of your question, Kelly. Is it going to get paid by insurance? It's too soon to tell you that. As a biller, we need lots and lots of data to confirm that yes, it is usually paid or not. So it is a new code, and most likely, from my experience, it will get denied in the beginning because all Medicare and other insurances might not know that this code exists because their systems are not updated as fast as the codes are created. So these codes are, they might get into medically necessary. Why are they going to get paid? But overall, looks like these are new codes which might get paid, and it will be very interesting. I will keep an eye. Thank you for your question on whether they're going to get paid or not. But I would encourage you to start billing them and also let us know what's your experience with these codes. It was a good question. Thank you once again. Oh, you're in North Carolina. Thank you for letting me know. And we can probably exchange notes after later once you start billing. And we also can get some more information on this new code which came up. What's the next question is, let me take up the next question in the interest of time. Okay, we have an OT question. Hi, Trixie.
Hi, Ritu. I'm apologize to all our viewers. I'm really having some difficulties here, but I know you
Right.
answer some of the questions our today's medical billing
Mhm.
Q&A,
Right.
and
All right.
yeah,
I think Trixie, you're still having some issues, technical issues. So let's see if I can continue with asking questions. And while you are checking your system, it happens, and especially it happens when with streaming, sometimes becomes difficult. So I'll probably take the next question, which is an OT question. OT is occupational therapy. And as I'm just like speech therapy, occupational therapy is becoming very popular, and more insurances are paying for these kind of therapies now. And we have Mard asking us with 8 minutes rule in 40 minutes OD session, how many units can be built? So now, yes, there is an 8 minute rule. That is true. But what we have to keep in mind with the 8 minutes rule is what is the 8 minutes is the minimum time frame, but there is a maximum time frame of less than 23 minutes. So one unit is equivalent to 8 to 23, or I would say 22 minutes. Then the next time you can, if you see patients, the same patient for the 23rd minute, then you will be able to build it for 2 units, which is 23 to 38 minutes. I know these are very weird kind of time blocks they have created, but this we have to follow the rules as far as the units are concerned, as per AAPC guidelines. And I think you will be able to bill for 40 minutes. You will be able to bill 3 units, because the third 3 units can be billed if you see the patient from 38 minutes to 53 minutes. So you cannot bill 4 units unless you have seen the patient for more than 53 minutes. So hope that gives you a clear answer on this question. And I think if there's no further question from Mad on this particular query, we can go to the next question. Okay, the next question will be from Patty. I have 4 years of, can I get this question a little, I can't see the entire question. Oh, it's not a question. So Patty, I appreciate your, interest in working with us, but I think that's a separate conversation and forum. But I like that you are interested in working with Neolytix, so we can definitely have you sent to our recruitment division and our recruiters. So we will send your information. All right. We have Paula. So we have had a great opportunity to work with you, Miss Paula, and I think we are still working in some way or form with your organization. And I appreciate you joining us for this session. I know you can hear me, but just saying hi, because we have been working closely with each other for a long time. And now I know you are running your own practice. Great. So Paula, you are asking about what is the best way to negotiate higher rate for speech therapy or for speech pathologists. Do you have success in accomplishing this on behalf of clients? Great question. Thank you so much. And there are many ways to negotiate for higher rates. And one of them is if you are a part of an IPA, which is Independent Physician Association, or you're a part of an MSO, which is management service organization like Neolytix. If you have, some contracts through a bigger organization where more providers and more, specialists or pathologists are a part of that group, insurances will look at you. It's more like, you get better value or better, buck for your money if you buy from Costco versus if you buy from Jewel or Osco. So it's the same thing which happens with insurance contracting rates. Having said that, if you are individual provider, we still have a good success rate of negotiating, but it will depend on where you are, which state you are in, which zip code you are in, how many SLPs are already operating in your area or zip code, and how many patients are coming to you for that particular insurance you are trying to get higher contracted rate for. So there are many parameters, there are many ifs and buts before we can give you a real answer. Okay, you can do this or that for your organization to get a higher rate. Success rate to get a higher contracted rate is, like we've seen, as good as 70% in some cases, or as bad as just 30%, depending on what specialty we are going for, getting them better contracted rates, and what is the demand of that specialty in that particular area where you're working from. So, but I would always encourage everybody to create a business case for yourself with your rep for the insurance company, or reach out to Neolytix or as any such professional firm to work on your behalf and create a business case for you or your organization to get higher contracted rates. So I'm hoping that answers your question, Ms. Paula. And I am ready for the next question. And let's see. Okay, so any speech pathologist? So we are getting a lot of speech pathologist questions. Great. So it looks like we have a good audience who belong to the speech pathologist world. So this question says any speech pathologist can perform codes 92521. All right. So let me just again check what are these codes, because I am still a human, not a machine, and I need the definitions of these codes. And I guess, okay, so let me thank you, Vasanta, for the definitions. But to answer your question, yes, and let me just clarify. This is particularly, you are maybe asking any speech pathologist based on a certification, a specific certification you might or might not have. So based on AAPC, I don't think you need any specific certification to bill out these codes, because these codes are, as long as you are a licensed speech pathologist, you can bill this code out, these codes out. These are evaluation of speech production, and with different levels, depending on how much time you spend with the patient. So the answer to this question is yes. There are no regulations or guidelines to for these particular codes to have any extra certification. So I hope this answers your question. And we are ready for the next question. Is there any need for having modifier in place when billing for in-office psychotherapy evaluation? Once again, psychotherapy evaluation world changed because of COVID, and we get a lot of such questions based on in-person therapy, what place of service we should build the therapy session if we are seeing the patient virtual. So there are many questions about psychotherapy, and I'm hoping we can get more of these in this session. And the answer to this question is no, we do not need any modifier if you are having a psychotherapy evaluation in office, face to face, in person with the patient. You do not need any modifier. So that was a fairly simple answer. So you just need a psychotherapy code based on the time you spent with the patient. All right. So that was a very simple question. I'm ready for the next question. All right. So looks like it is kind of a crazy question, I would say. I don't know if you guys can read it, but let me read it aloud. It says, hello, crazy question, but is there an unlisted speech therapy code? Okay, let me talk something about unlisted codes. So unlisted code means you are trying to ask for money or inform insurance about a procedure you did, which is not, for that, there is no code given by or created by the coding, in the coding guidelines or in the coding dictionary. As you all know, there are many codes, CPT codes available. And these are the unlisted codes allow you to bill for something which is not yet a actual CPT code or which is given in the coding dictionary. So there is a code which you can use if you are trying to build maybe a tool to get a speech therapy or to check some, do some tests for your patients. And it is 92700. As if my team at the back end can flash that answer. I don't know if it is possible. And so that you can make a note of it, which can be used with speech therapists and even audiologists can use that code to let people know or insurance know that you are trying to bill for something which is not listed yet. But you always have to provide more information to insurance, any insurance you're billing, that what are you trying to ask for from insurance. Like if you are billing for a tool, you have to give the tool information in HICFA 1500, which is there is a box 23, so to say, where you have to inform, okay, I'm trying to bill and this is what I'm trying to bill. It can be a medication. You have to give the NDC number there. It can be an implant which does not have a code. It's new in the industry and in healthcare industry, and you have to give their name there or their code there. So unlisted codes can be given, but you have to provide extra information. Sometimes you can provide extra information in form of some other code like NDC number or the patient number or the code number for the product. I know we have the next question available, but let me just complete this answer because it is actually a very good question which can help others, even those who are not speech therapy therapists, that you can still bill for things which don't have a code, but you have to provide extra information to insurance. And if they deny your code or claim, you should go back and provide documentation, details about your product you are trying to bill to the insurance so that they can understand what was performed or what service was given to the patient, and you might get paid. All right, I hope that answers your question, Reese. So, and now I'm ready for the next question. This is a long question. I am a psychologist permitted to use independent contractors psychotherapy under my contract with Empire Blue Cross. Okay. So in short, this question says that you are trying to do, incident to billing, where you are not seeing the patient, but your, independent contractor or student is seeing the patient. So yes, you can bill. As I just said, I answered the first question for speech therapist. This answer or this incident to billing is allowed for any specialty. And the way you bill is you should be the person who's able to bill out the insurance should be the supervisor. The person who's seeing the patient should be the supervisee, and the supervisor has to co-sign the progress note. Not only co-sign, but understand what is happening with this patient, the treatment plan, and approve the treatment plan for the supervisee. And the box, the supervisor's NPI goes on the claim, not the supervisee, not who's seeing the patient actually, but supervisor NPI is the rendering provider NPI. That will go in, Vasanta, correct me if I'm wrong, box 31. If you can just remind me of the box number of the HICFA form. And the billing provider will be the group or the tax ID you are billing under. So that would be the box numbers per se for putting, 24J. Thank you, Vasanta. So 24J would be the name of you if you are the psychologist who is trying to bill on behalf of your independent contractor. I hope that answers this question, which is coming from SupplyMate. Okay. All right, I'm ready for the next question. Okay, I'm a licensed clinical addiction specialist. Okay, so thank you for this question. This is coming from some other platform to us. And the answer to this question, that even if you when you are a licensed clinical addiction specialist or you are a licensed clinical social worker, the CPT codes they offer the in-group or individual counseling, they remain the same as any other, LCSW or LFMTs. Everybody will be billing the same CPT codes per se, which are, if I can give you the actual CPT codes. Vasanta, please help me at the back end to give me the CPT codes for group therapy and for individual therapy. Let's take 60 minutes just for the sake of saving time. And both the codes 90837 for individual therapy and 90847 for the family or group therapy. So your CPT codes will remain the same. However, being an addiction specialist, the only difference will be what family of diagnosis codes you will be billing as primary diagnosis code for that therapy. So I'm hoping you get that answer. And I'm ready for the next question. Okay, that is an interesting form of therapy. Again, it is not a very, very broadly used kind of therapy, especially when we are trying to send it to insurances. But again, it is a psychotherapy. I think my answer will be almost a repetition of my first question. Different kinds of therapies are still considered psychotherapy, and they will still be billed with the same codes we just talked just a few seconds back. So they are the only difference will be why are you doing the therapy, then it will come to the diagnosis codes you're using. So anytime you are doing a different kind of therapy, till now we do not have different codes except for the very first question which Kelly asked, if you all remember, where we were doing the life coaching, which was a little different than therapy. So according to me, reunification therapy is the same codes with family, without family, with patient. You just have to follow the psychotherapy codes for when it comes to CPT codes. All right. Are we ready for the next question? Okay, so while we are waiting for the next question to pop up, I can still talk about therapy, mental health and therapy for a long time, because we've been at Neolytix, we've been blessed to have multiple therapy clients taking our, starting with us, and we've seen therapy grow, the therapists grow their business, and we are really lucky to be a part of their success stories when they are adding different kind of therapies, and it's becoming very interesting and a vast field which we are always learning from. Okay. All right. So, here we have another question from Twitch. In 2021, our CPTs 96136 and CPT 96137 for an hour. And let's see. So I don't know why we are almost done with 2022, and we are getting a question for 2021. I'm not sure if it is, by chance, but anyway. So I think the answer to your question is the time limit. I think it's still 30 minutes, but I can ask Vasanta to confirm. For both the codes, there is no change on the 30 minutes session. It's still first 30 minutes, yes. And Vasanta is, giving me the same answer. 96136 is for the first 30 minutes you are, seeing the patient, and 96137, if you are seeing patient for additional 30 minutes, you will add that code to your claim. That overall will become 1 hour. So it is not 1 hour. If you're getting conflicting information, I think you can just say that it is only first 30 minutes is 96136 and next 30 minutes will be 96137. All right. So even in 2022, and the answer is still the same. Okay. And we have next question from text. Is CPT code 92523 a timed code? All right. So first of all, I would say I need the, let's get everybody a definition of 92523. And before even I ask, I'm seeing that I'm getting an answer. And 92523, according the evaluation of speech production, is not a timed code. It is, you have to build one unit. It should be, it is not built as per the 15 minutes or 8 minutes rule, like many other time codes. So the answer is, it is not a timed code. You will have to build one unit based on the session. Okay. All right, I'm ready for the next question. Okay, it keeps going back. So we have, how many students can be seen in a group when billing for school-based therapy? As far as I know, group therapy, the rules and regulation for group therapy are the same, which is up to 12 people. So whether it's school-based or it is a group, community group-based, or it is just a group therapy you are doing in your clinic or your office. So the rules say for the group therapy code, and I will ask my friend Vasanta here to give me the actual code for the benefit of everybody asking and listening to the stream and asking questions. The number of people here should be up to 12. They can be anywhere from 2 to 12 to make it a group. And we will probably, let me see if I can give you the code before the next question comes up for the group therapy. And but overall, the answer to this question is up to 12. All right, let's wait for the next question. Oh, okay. So this looks like a little technical question. So, which is involving some primary diagnosis codes of with 96116. So let me just give a little bit of background. This is the mental health code 96116. So it is a mental health related billing question for everybody. And I will probably give you the detailed. So it is a status. It's a neuro behavioral state status exam, which is more like an assessment code for 96116. It is not a therapy session code, and the code which you are or your doctor is trying to bill, S06.2X9S, is not an LCD, not under the LCD guidelines. Just to give you an idea, LCD guidelines are published by AAPC and CMS. CMS publishes the LCD guidelines for the diagnosis codes which will be allowed to bill with a certain CPT code. So with 96116, this primary diagnosis code is not the correct diagnosis code. Neither is your secondary diagnosis code is correct. So you need to go back and check the LCD guidelines, which I believe will only allow you to build the F series of diagnosis code with this particular CPT code, which is just an assessment, clinical assessment based on the on the surveys and other surveys or some questionnaires your office might have sent to your patients or your doctor asks when they see the patient. So this denial is correct, and you'll have to go back to LCD guidelines in order to find the F series code, which is allowed with the CPT code. So I hope you get this answer, which will help you in getting paid for 96116. All right, we are ready for the next question. Okay, so 92533 and 92507 for a pediatric visit. So I think let me first start with this the definition of the or using two codes or two different services in the same um, visit or same claim. I know why this question is coming up from Monique, most likely because you are seeing a lot of denials based on using two different codes in the same claim. So the most interesting thing is when you're trying to build two services in one claim, you should be looking at NCCI, the edits so that there is no conflict or there are no rules that you cannot bill these two services on the same day, in the same visit, on the same claim. And then second thing you need to look for is if there's any modifier needed. So going back to my first, a comment on this question, NCCI edits, there are none reported as per AAPC guidelines on these two codes. So you can build these two codes. It is allowed. Having said that, you should now look at the requirement for modifier so that the insurance is not coming back and saying it is 92533 is a part of 92507. So you need to unbundle or make it a distinct procedural service in order to get it paid. So you can try using 59 XU modifier, whatever is required, or whatever is based on the insurance you are billing. So, but at the same time, don't take my word that it will get paid, because it is always a little difficult to get two services paid in the same claim. It all depends on your insurance, their guidelines, and if they consider that yes, these two are unbundled and can be paid in one visit. And last thing I would tell you, Monique, is to make sure your diagnosis codes are connected correctly with each code, CPT code here. So I hope that answers your question for this one. And I think I'll be ready for my next question. All right. So is there any age limit for billing of OT code 97165? And I guess for my senior medical biller, Vasanta, just gave me this information because, as I said, I have to review the definition before I can give you the answer. And there is no age limit for 97165, which is occupational therapy evaluation, low complexity, which is 30 minutes code. Because in 2021, especially for therapy, I think the time limit, the time frame for any code is the most important than the complexity version, because the Medicare is trying to, CMS is trying to give a better way of seeing patients for most therapists, saying that, okay, you have to make sure you are seeing the patient for 30 minutes. So you have to remember your time as well as the complexity. So the answer is no, there is no age limit for this 97165 code. When we bill a 90837, does that also include doctors using this time to document in the patient's time? And let me just start by saying that this is a very important and good question. And I'm hoping we have some, mental health billers, providers on this session, and they can really learn from this answer I'm about to give you. And I get this question all the time, and I try to educate my therapist all the time about how and why we should bill this particular code. Like, for example, this is 60 minutes with patient, and what are you doing in that 60 minutes? That is really important. And the let me just start with this question where they're asking, use this time to document in patient's time. What I'm thinking this question is asking me is, if the therapist is writing notes, can this be included in the 60 minutes we are seeing the patient? Yes. What other things can we include in the 60 minutes is when we are reviewing patients, patients' medical records, let's say, which were sent by their PCP, or we are looking at past history, which you got from a colleague who referred you this patient. All that, anything where you need a clinical experience and expertise to for this particular visit is included or can be included in 90837. But for example, if you did, let's say you called insurance to confirm if this patient has mental health benefits, that time is not included in this 60 minutes. If you call insurance to get authorization for this patient's visit, that time is not included in this particular visit. So the only time as a therapist, if you did clinical work in this time, even though before seeing the patient or after seeing the patient, you can include in the visit time of 60 minutes. Hope that answers this question, and people can definitely code appropriately after getting this information. All right, we are ready for the next question. Oh, that's a long one. Okay, we have a medical question. I think this is the first or maybe the second medical question, not the therapy question. We have hospitalists perform NSTs and ultrasounds on the patient that are seen in triage and antepartum. How do I code multiple NSTs performed on the same date of service by different physicians? Okay, so interesting question. And just to give you, again, an idea, when we are billing with multiple physicians on the same day, which is, patient is about to deliver and 5 people are coming to see the patient in rounds, and you are a biller for that group or the physician group or the hospital, where you are billing for part B, which is the physician time, not the facility, and that is called the professional claims. You are trying to bill every visit for every hospitalist, but you're billing under one tax ID. At that time, this problem will you will see this problem of not getting paid for on the same date. If you're billing the same service over and over again, you will most likely get denials. And the only way I can probably tell you can get paid is if you are telling the insurance that every time you build an NST or every time you build an ultrasound, it was a new ultrasound done, or it was a new, NST is being done every hour, or it's being, it's changing, and the new provider or the second provider coming to see the patient while the patient is in the triage is checking a new report, because you are very rightly using the modifier 26, which means that your provider is just reading the report and they are not performing the NST. They're not using the technical, you're not using the technical part of that particular imaging, which is NST or ultrasound, procedure. So the codes seem to be correct. However, in this case, I would ask you not to use 59 as such, 59 modifier, because you should be able to get paid for the visit and the NST, at least one in every day, without using 59 modifier on the same day. But if you use 59 modifier to be billed or paid for same physician performing these procedures more than once, then you will not. You will most likely fail in getting payments. 76 or 77 modifier, for the benefit of everybody, it basically means this procedure was done more than once in one day by the same physician. I think is 76. Let me confirm what Vasanta helped me with. Yes, 76 is same physician, and 77 is different physicians did the same procedure more than once. Those modifiers are better. Please use them. And the only way you can get these paid eventually would be um, if you are appealing these denials and telling that and giving more documentation and creating a case for you for your practice that yes, these services were actually performed and given more than once, same or different providers, it all depends, but you have to add documentation and appeal your case to get paid, because otherwise it will be difficult to get paid on the same day. I know it's a little complicated question, and I hope the answer was, clear enough for you. And if not, then please send us, more information later. We can help you. All right. Is it against the law to bill LMFT under LCSW credentials? Oh, okay. I'm not very sure about this question. If you're saying that you are like your official credentials are LMFT and you are trying to bill under an LCSW, I'm not too sure if you are both. You are both LMFT and LCSW. But if I'm trying to understand this question correctly, you are saying you are an LMFT and you want to bill therapy under an LCSW, um, LCSW credential, or a person who's an LCSW and who is a different person than you. If that is the case, then again, it is not against the law as long as you are following the incident to billing guidelines, which I just explained a couple of times during the session. So this again boils down to incident to billing, where you are seeing the patient, but LCSW is billing on your behalf, and you should be you are going to be considered a supervisee if you are the LMFT, and the LCSW is a supervisor, and the claim is going out under her or his name and with his or her credentials as LCSW. And your NPI or credentials will not show on the claim, but the you need to co-sign. You have to follow all the rules of incident to billing. If you need more details on incident to billing, please reach out to us on any social media and we can help you with those rules and regulations for incident to billing. Okay. We can have the next question. Oh, we just have 5 minutes left. Time flies when you're having fun. Okay. Can psychotherapists living in Los Angeles still bill answers CMS 1500 paper forms? Wow. Okay. I was thinking if you are billing on paper forms, you might be living, not in Los Angeles, because Los Angeles seems to be a more urban place to me. But yes, the answer to your question is if you still want to bill paper claims and your list does not include Medicare, the answer is yes. However, you have to confirm with your particular insurance plan you're trying to bill and see if they still accept paper forms. Medicare does not accept paper claims anymore. And that goes for irrespective of which state you are in. Medicare, you have to bill electronically. And I don't see Medicare in your list, although it might fall in the etc. But Anthem Blue Cross, I know, still accepts claims on paper. And the best way would be, I'll encourage you to go to each insurance website or call the phone number and ask where to send the claims if you're using paper claim forms, and get and confirm if they still accept it. But most insurances still accept it. And I believe we are almost out of time. It's 11:27, and this session would be ending at 11:30. So if we missed your question, and any other question we had, we definitely still have those. We will still go back and try to answer your questions. And if you have left details, your contact details with us. And if you still have questions while the session is over, please feel free to send these questions to us. And if you have any other questions regarding Neolytix, please, you can reach out to us at the numbers flashing down at the banner, or you can reach out to us at any social media platform you see on our website. And we will be always blessed to have these questions and have given answers to all of you, whether it is related to contracting, billing, coding. We will be able to, we will try our best to help you in making your practice, your billing career a success. And hashtag Ask Neo. So that's what I will say. And thank you so much for attending this session. We appreciate your time. And I would just, in the spirit of Thanksgiving, which is coming up, I would say I'm thankful for this opportunity that I was able to answer questions. I was able to take these questions from you. And I'm hoping that I was able to add some value to your, to your knowledge here. And we wish to continue doing that at Neolytix. And just want to add one more thing, that we are we are management MSO here at Neolytix, and we provide many other services other than medical billing or coding, like virtual assistant, practice concierge, and marketing. So again, reach out to us at Neolytix, sales at neolytix.com if you have any questions. Thank you so much for attending this session. Thank you and have a good day. Bye.